To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, today we're going to talk about breast cancer rehabilitation, and I am joined by Lindsay from Uplifted Oncology Rehab. Hi, Lindsay.
Hi there.
So great to have you in. So when somebody has the breast cancer diagnosis, that's a scary time, right?
Absolutely.
What are some of the medical treatments and procedures that a patient will go through?
Absolutely. Well, it obviously depends on the level of their diagnosis, but many of them will participate in usually four different types of treatments, either surgery, radiation, chemotherapy, or immunotherapy.
So those are great for beating the cancer.
Correct.
But that probably doesn't help the body real well, does it?
Absolutely.
What kind of traumas will that body go through?
Oh, there's so many different traumas that a patient will go through when they're undergoing all those different procedures. When we're talking breast cancer, we're talking the shoulder region, and there's so many different levels and systems that a patient will have trouble with, such as skin, muscle, our lymphatic system runs through our arms, as well as nerves and our blood vessels.
And those are important things that you can help prevent. So if we don't do anything about it during, what are the long-term problems?
There's many complications if you don't get that early rehab. One of the most common is lymphedema, which is chronic swelling, and individuals will see that in their upper extremity or even in their back or their chest. Fibrosis is a common one, which is basically painful scarring that happens and can be very painful and debilitating, as well as loss of function. I mean, our arms are we use our arms all the time, so if they don't have that, that can be very hard.
Yeah, and so your cancer is gone, but
yes,
the effects are forever.
The effects are forever.
So how does Uplifted Oncology come in? What do you do for those patients?
Oh, absolutely. So I've developed a program at Uplifted, and so my goal is to get on top of the treatment as soon as possible, so very much prevention. And so at the time of diagnosis, and then I follow them every single step of the way to help them recover. I do a lot of hands-on techniques as well as teach them different exercises and strategies to help heal.
Yeah, do you have a number one, like your favorite go-to for breast cancer patients for rehab?
Just honestly, the hands-on techniques. I mean, with the trauma between the surgery and radiation, you just need that hands-on techniques to really help that body heal correctly and effectively.
And treating it early, right when that diagnosis.
Absolutely, at the time of diagnosis, so that we can stay on top of it so that tissue has a chance to heal correctly.
Well, Lindsay, thank you so much for this great information. I think if anybody has that breast cancer diagnosis, so important.
Yes,
all right.
Absolutely.
Thank you so much, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.